Welcome to my world. Another day is here today. We shall improve on the knowledge acquisition. Our health is wealth, knowledge is power. Today I shall be talking more on the benefit of Ewedu from the laboratory finding. Ewedu is also called JUTE leaf. It has so many names, and that may explain why it is widespread, because it has so many benefits. But what are the benefits that will benefit our health, especially men who have high PSA or are coming down with prostate problems, prostatitis or prostate cancer? This is what I intend to expose to us so that we can benefit from the knowledge that this channel will present. If you like what you see, press the like button, subscribe, and we continue to pass on more knowledge. Thank you. Prostate cancer. Ewedu benefit from laboratory findings. The outline. I shall start with the introduction of terms. Role of antioxidant in prostate cancer. Role of calcium in prostate cancer. What are the constituents of JUTE leaves? Ewedu. Research finding of the effect of JUTE leaves on the testosterone and the PSA value, the ADHD. Conclusion. The introduction of terms. We must familiarize ourselves with the prostate cancer and prostatitis. The prostate gland is a small wallet-shaped gland that sits behind the bladder in men. The prostate gland can become enlarged, a condition known as benign prostatic hyperplasia or BPH. It is controlled by powerful hormone known as the sex hormone, including testosterone. In the prostate gland, testosterone is converted to another hormone called the DHT, dihydrotestosterone. The high level of DHT causes the cell in the prostate to enlarge, and that's what usually happens when men are growing older in age. Despite that they cannot really at this time, because the prostate gland has now enlarged, and that is a very important factor in prostate problems. The PSA is a blood test, usually done primarily to screen for prostate cancer. The test measures the amount of prostate-specific antigen in the blood. PSA is produced both in cancerous and non-cancerous tissues in the prostate. So it is that increase in the PSA value, usually above 4 nanogram, that is almost taken as the patient developing prostate cancer. But at times it could be higher than that, and there is no prostate cancer. This is the normal prostate here. The urethra is not constricted. You can see the passage so easy. But here there is serious constriction because of the enlargement of the prostate. And that's where the problem of urination and other problems, the cancer will down develop. So this is prostatitis. Role of antioxidant. We need to consider the role of antioxidant. Since we are talking about Ewedu, you will get to know more about that the JUTE leaf contains most of these antioxidants, and the importance of the antioxidant will be also specifically expressed in terms of how it helps to fight cancer, because it is the free radicals that really cause most of these cancerous problems. So the antioxidants commonly found in fruits and vegetables are vitamin A, vitamin C, vitamin E, beta-carotene, lycopene, which is a very powerful one found in tomato, lutein, selenium, magnesium, manganese, and the flavonoids, and so on and so forth. The benefit of these antioxidants is what shall be listed now. So they reduce oxidative stress, that is, the free radicals that are usually produced, especially after metabolism. Those who eat too much at times, they produce these free radicals that create the oxidative stress, and it is the antioxidants that will counter and make that situation back to normal. The free radicals also, the antioxidants also help to reduce inflammation. Inflammation is a serious problem as regards health issues, because it suddenly creates a situation of malignant reaction. The immune systems are excited and they come up. The antioxidants support healthy aging process. So when there are antioxidants, the wrinkles and what have you do not quickly come out, and so it helps in minimizing one developing cancer. So the antioxidants are so much present in Ewedu, and that's why it is being discussed along with whatever decisions we want to talk on the jute leaf, or Ewedu as it's called. The role of calcium in prostate cancer needs to be mentioned as well, because the jute leaf contains a lot high calcium. So let's look at not getting enough vitamin D or having a vitamin D deficiency has been connected to higher risk of having prostate cancer. According to a study in clinical cancer research, that was the finding. Other research prostate sources have found that people with higher level of vitamin D have lower level of PSA. So the vitamin D, we know, is very useful in the absorption of calcium. So it is very necessary probably, and vitamin D is not well. The research conclusion would help us determine what the importance of vitamin D in this study. There is good evidence that men whose diet include a lot of calcium, or those who take calcium supplements, are at increased risk for prostate cancer. Scientists know that more than enough amount of calcium taken every day can interfere with absorption of iron, zinc, and magnesium, and may result in kidney stone or kidney failure. So these are other reasons why, because there is high calcium in Ewedu, we must also consider that aspect, even when we are using it for as a prevention against prostatitis or prostate cancer. Hypocalcemia is low level of calcium, can cause an abnormal heart rhythm. So you can now see that you have a situation where you don't want to have low calcium but not too high. That is very important for us to take note of. And the normal calcium values are listed, 8.5. The consequence of jute leaf. Let us look at the consequence of jute leaf from the study of St. Nicholas Hospital. This green leaf living vegetable is rich in beta-carotene for good eyesight, iron for healthy red blood cells, calcium for strong bone and teeth, and vitamin C for smooth clear skin, strong immune cells, and fast wound healing. Vitamin A, C, and E are present in jute leaf, in Ewedu, I didn't see the E. The E is a very powerful antioxidant, and then sponge up free radicals, scooping them up before they can commit cellular sabotage. That is, before they go as far as the nucleus, damaging the DNA, producing mutants of DNA, which result in cancer. The free radicals are the byproduct of reactions that occur within the body and can cause damage and disease over time. This is what Ewedu contains, and it's as listed. It contains also vitamin C, ascorbic acid. Ewedu has an antioxidant activity of 77%, so that should be something encouraging us to take Ewedu. But like I said, the calcium is another worrisome area that one should take care of. This is the calcium level, 266 in the diet, but that's the maximum you probably need in your serum should not be too high, above 12 or thereabout. Then it contains the antioxidants, like we are told, A, C, and E. But we didn't see zinc and selenium. But these are, the E is not listed here. But when you look at this, is the jute leaf, the Ewedu leaf that you can use. Research finding of the effect of Ewedu on the testosterone. Examination and evaluation of photomicrograph of the testes of the different animals, because animals, rats were used, laboratory rats were used, and the Ewedu was extracted, the leaf extracted and tested on the rats to see whether it has any effect on the testes of the rats. The histological examination was what to show. So, to show that the extract has no effect on the cytoarchitecture of the testes. So, the testes was the area of concentration to look at whether there is any effect. The seminiferous tube and the interstitial component were all seen intact without distortion or degenerative tendency, enhancing improved synthesis of testosterone and maintaining a normal testicular histological feature. Could mean that people, especially male, should be encouraged to feed on plants to achieve and improve fertility status, and possibly also enjoy a general well-being of health of the vital organ, which agree with the finding of Obembe and Ige. So the research finding is suggestive that if it can maintain that level of testosterone, the DHA1, so long as that is not increased, there will be not much enlargement noticed. So when there is not much enlargement, there will not be constriction of prostatitis, which could eventually lead to high PSA if there is a problem with the tissues around the prostate glands. In conclusion, Ewedu, like other vegetables and tomatoes that contain powerful antioxidants, as proven in the research, are desirable in management and prevention of early onset of prostate cancer. So, to me, I can say one should take Ewedu, but the caution is now it is necessary that one should avoid calcium fortification when you are taking it, so that since it contains high dietary calcium, but vitamin D may be helpful in lowering the serum calcium level that could also have some consequences when it's too low. So I thank you for listening all through.